I chose to do my Build a Lecture for Chapter 21, Infectious Diseases Manifesting in the Cardiovascular System and the Lymphatic System. 21.1 is the cardiovascular and lymphatic systems, their defenses, and normal biota. The cardiovascular system is the pipeline of the body. It is composed of blood vessels that carry blood to and from all regions of the body, and the heart that pumps the blood. It provides tissues with oxygen and nutrients and carries away carbon dioxide and waste products, delivering them to the appropriate organs for removal. The heart is a fist-sized muscular organ that pumps blood throughout the body. It is divided into two halves. Um, the upper chambers are called atria, and the lower chambers are called ventricles. The wall of the heart has three layers: the epicardium, myocardium, and the endocardium. The entire organ is encased in a fibrous covering, which is the pericardium, and it is occasionally a site of infection. And the endocardium also covers the valves of the heart, and it is a relatively common target for microbial infection. The blood vessels consist of arteries, veins, and capillaries. Um, the right atrium, it receives blood coming from the body, and that blood is low in oxygen and it's high in carbon dioxide, and it passes through the right ventricle. And from there, it's pumped through the pulmonary arteries to the lungs, where then it becomes oxygenated and it enters the heart through the left atrium. And then the blood moves from the left ventricle, and it is pumped into the aorta and then the rest of the body. And then the arteries, they carry oxygenated blood away from the heart under high pressure, and they branch into smaller vessels that are called arterioles. And then veins, they hold blood. And when you do an IV, for example, you put that IV catheter into a vein. And then the capillaries, they connect the arterioles to the venules. This is the anatomy of the cardiovascular system. You have the superior vena cava, the right pulmonary artery. Also, let me mention that when it comes to the heart, everything is flipped. Like the right side is the left side is the right side. But anyways, you have the pulmonary trunk, the right atrium, the right pulmonary veins, the fossa ovalis, the muscles, the tricuspid valve, the right ventricle, anterior vena cava, aorta, left pulmonary artery, left atrium, left pulmonary veins, the mitral valve, aortic semilunar valve, the pulmonary semilunar valve, the left ventricle, the other muscles, intraventricular septum, the epicardium, myocardium, and the endocardium. Um, the lymphatic system consists mainly of the lymphatic vessels, lymph nodes, and the spleen. The lymphatic vessels are parallel to the blood vessels. The lymph nodes cluster at body sites like the groin, the neck, the armpit, and the intestines. And then you have the spleen. And this system collects fluid that has left the blood vessels and enters tissues. It filters it of all of the impurities and infectious agents like bacteria and stuff like that, and it returns it to the blood after it filters it. Um, Defenses of the cardiovascular and lymphatic system is that first, it's highly protected from microbial infection, and the blood is full of leukocytes, and they have about 5 to 10,000 white blood cells per microliter of blood. Um, the types of white blood cells are lymphocytes and phagocytes. Um, Lymphocytes are responsible for adaptive immunity, and phagocytes are critical to innate as well as adaptive immune responses. The cardiovascular system defenses is phagocytosis and adaptive immunity, and the lymphatic system defenses, they have numerous immune defenses. Normal biota of the cardiovascular and lymphatic system. The cardiovascular system and the lymphatic system are closed systems with no normal access to the external environment. The lymphatic system filters microbes and their products out of the tissues. Um, the cardiovascular system's normal biota is sparse and it's mostly in the white blood cells, and the lymphatic system's normal biota is unknown. 21.2 is infectious diseases manifesting in the cardiovascular and lymphatic system. The book mentioned, I'd say, roughly 20 different ones. I didn't add every single one of them in here, but I did add the ones that I knew a pretty good much about. Like COVID. COVID originally started in 2019, became a big deal in 2020. There was staying 6 feet apart, there was isolation, there were vaccines, a lot of sickness, a lot of death. It was caused by SARS, which is the severe acute respiratory syndrome. And then the CoV-2 is coronavirus number 2. The most common mode of transmission was droplet and airborne. You could get it like being close to somebody, which is why social distancing was a thing. You can get it from coughing, sneezing, even talking. Diagnosis was AB and AG tests. Another test, you would take a swab, you'd swab the nose and test that way. There are vaccines now to prevent this. Treatments included antivirals, and some signs and symptoms were body aches, nausea, vomiting, diarrhea. Some people had skin rashes. Some people in like critical cases, they had heart damage, joint pain, and other bad cases, there were blood clots. And then the most normal ones were loss of taste and smell and headaches. Infective endocarditis is inflammation of the endocardium or inner lining of the heart. It refers to an infection of the valves of the heart. Signs and symptoms include fever, anemia, abnormal heartbeat, heart attack, shortness of breath, chills, abdominal or side pain, petechiae, which is like red or purple dots on the body, etc. There are plenty signs and symptoms. The most common modes of transmission were for acute endocarditis, it was parenteral. And then for subacute, it was the endogenous transfer of normal biota into the bloodstream. It was diagnosed via blood culture, and to prevent acute endocarditis, you would get an injection, and subacute, it would be treated with antibiotics. And an antibiotic includes vancomycin, and surgery for acute, and then antibiotics and surgery for subacute. Sepsis, also called septicemia. Many different types of bacteria cause this condition, and it can be very fatal if it's not treated in time. I see a lot of patients in the hospital coming in and they're septic, and a lot of them end up dying due to that. Some signs and symptoms are a high fever. It can cause an altered mental state, shaking, chills, increased respirations, low blood pressure. The most common modes of transmission are parenteral or endogenous transfer. We see a lot of septic cases in patients who have had surgery recently. It is diagnosed through a blood culture, and it's not really something that you can prevent. Sometimes it just happens, and it is treated with broad spectrum antibiotics. The plague, which the first one killed an estimated 100 million people. It was brought to the U.S. through the port of San Francisco around 1906, and it is said that it was brought in by infected rats. I know that it was really, really dangerous. Some signs and symptoms are fever, chills, headache, nausea, weakness, even death happened. The most common modes of transmission were fleas, droplet contact, direct contact with body fluids of someone who's infected. It was diagnosed with rapid genomic methods. It could be prevented by flea and animal control, and there are vaccinations now. And treatment is streptomycin or ciprofloxacin. Tularemia is a zoonotic disease. Signs and symptoms include headache, backache, fever, chills, malaise, weakness, skin lesions like rashes and stuff, swollen lymph glands, sore throat, sore lymph nodes, body rashes. The most common modes of transmission were through ticks, with direct contact with body fluids from an infected animal, or it was airborne. Now, diagnosis, taking a culture is really dangerous to lab workers, so it wasn't really used by diagnosing with a culture, but fine needle aspirations were sometimes used. There is no prevention listed in the book for it, but treatment is gentamicin or streptomycin. Infectious mononucleosis, also called mono or the kissing disease. Signs and symptoms include sore throat, high fever, skin rash, in some cases, an enlarged spleen and liver, fatigue, mouth sores, bad breath. So, the most common modes of transmission are direct and indirect contact. It is diagnosed through a differential blood count, a monospot test, and then specific ELISA. There isn't really any prevention for it, but once you are diagnosed with it, it is with you for life. Like it is a lifelong persistence. And treatment is just supportive care. That's all I really have. Um, if you have any questions or thoughts, please feel free to reach out for me. And thank you.